Sleep hygiene may be a new term for you as it was for me. We've all heard that you probably shouldn't play on your phone right before bed or go do an hour-long workout and then expect to fall asleep 10 minutes later. In a nutshell, sleep hygiene is the practice of healthful sleep behaviors to ensure we get a good night's sleep so that we have full daytime alertness. Melatonin, secreted by our hypothalamus, regulates our sleep-wake cycle. During the daytime, our melatonin production is suppressed, while conversely, darkness is associated with high melatonin levels. In fact, 1 minute of bright lights can suppress melatonin levels for up to 40 minutes, thereby delaying sleep for up to 40 minutes. Melatonin levels generally rise when the sun sets, hits its peak around 2 a.m., and is almost undetectable during the daytime. By 4 to 6 months of age, the day-night melatonin cycle is established. Lastly, maternal melatonin will cross the placental barrier and is passed along in breast milk. For children and adults, some risk factors for poor sleep hygiene include too much stimulation before bed, too much screen time throughout the day or right before bed, a room that is too hot, too cold, a room with too much light, a change in routine, eating or drinking too close to bedtime, and significant life changes. Complications of poor sleep are irritability, mood swings, hyperactivity, inattention, restlessness, and daydreaming depending on the age of the child. The psychosocial impact varies depending on the age of the child. You may see a child that has sleep disturbances at night, which may also affect the parent's sleep, an inability to focus during the day, trouble with school, or behavioral issues. Treatment revolves around assessment by the provider to determine what the possible cause of poor sleep could be. The patient and parents can help by keeping a sleep diary. Treatment also means implementing good sleep hygiene. A predictable bedtime routine is vital to good sleep hygiene. That bedtime routine could include something like dinner, then bath time, then reading, and then sleep. As I went over earlier, good sleep hygiene means maintaining a schedule. That schedule can include something like regular naps, a regular bedtime, regular wake times, even on the weekend, allowing the child to fall asleep while drowsy opposed to completely asleep, like say in the parent's arms, avoiding screen time 1 hour prior to sleep, keeping the room temperature below 75 degrees, decrease lighting in the room, and avoiding large meals or fluids prior to sleep. Diagnostic testing is sometimes warranted depending on the severity and length of symptoms. Actigraphy, sleep EEGs, and nocturnal polysomnography are all options if testing is required. Medications are not really recommended for helping a child sleep. You may have heard that Benadryl is a popular option to use, but once the medication is stopped, then we can expect to see the sleep issues return. Therefore, establishing a routine is the most important intervention for good sleep hygiene. Resources for patients include their primary care provider and potentially a sleep therapist who may use cognitive behavioral therapy as a first-line treatment for some older patients.